Right. So Leah, I'm going to pass it off to you.
Hi, everybody. Thank you so much for attending, and it is so nice. I see so many familiar names in the participant list, so welcome. This is a program being presented by Stony Brook Medicine, by the Health Program, Healthy Libraries Program. The presenters are myself, Dr. Diminich, Gabriella Pandofelli, Evan Marcus Gonzalez, who is one of our social work students, and we have a bunch of contributors, Dr. Lisa Ben-Scott, Mary Ellen LaSala, Carol Bellarata, Jessica Coos, Julie Erdman, and Talisa Tejada. Okay. You guys know me. I'm a social worker. Some of you know me. I'm a social worker, and I work for Stony Brook University for the School of Social Welfare. And you guys probably know me mostly from the work I do on the library program, where we place social work students in libraries. And we also have created this new program, HELP, where we have social work students, public health students, nursing students, and library students working together to provide health services to the library patrons. And Dr. Diminich is a clinical scientist and a research assistant professor in the public health program at Stony Brook University, and she received her PhD in clinical psychology from Columbia. She is a bilingual Latina clinical psychologist and has specialized training in trauma, mood and anxiety disorder, and she has expertise in developing and leading parenting groups focused on stress reduction and healthy relationships for parents of adolescents and teenagers. So invaluable information. And our students, Gabriella Pandofelli, she has completed her first year as a Master's in Public Health student, concentrating in health policy and management, and she is the program coordinator for the Healthy Libraries program, which is a tremendous undertaking that she does beautifully. And Evan Marcos Gonzalez has also completed his first year as a master's in social work student, and he interned for Amityville Public Library and is doing remote work for West Babylon Public Library and any other library that he's asked to help out with. And he also works for the Stony Brook Home, which provides medical services to people that do not have insurance. And just to give you guys a little overview of the HELP program, this is our Stony Brook Medicine Healthy Libraries program. It's a partnership with the Suffolk Library Cooperative System, and we are supported by the American Heart Association of Long Island. And it is an interdisciplinary team of public health, nursing, and social work students, and the aim is to provide evidence-based health information, screening, and case management. We refer patrons to promote access to appropriate health and social service programs locally that will address their health and also their social support needs. And it's a great opportunity for our students to experience working on an interprofessional team. We support programs, trainings, and provide resources for librarians and patrons. And the learning objectives for this session are that by the end, participants will be able to identify the signs of stress, list 3 recommended ways to cope with stress, identify the definition of mental health, identify 3 mental health warning signs, identify the definition of major depressive disorder, identify the % of adults in the US that suffer from an anxiety disorder, list 3 local resources for mental health, list 3 national resources for mental health, and feel confident in their ability to act as a resource on mental health information. Throughout this webinar, if you have any questions, please feel free to ask. If you're joining us via phone, you can unmute yourself and ask a question. And if you're joining via computer, you can enter a question into the chat box or use the raise hand function. And we really do welcome questions and comments and concerns, so please jump in.
Good morning, everyone. My name is Dr. Erica Diminich, and I first want to start off by thanking Dr. Ben Scott for inviting me this morning to speak with you, and Gabriella, who's been just fantastic in putting together the PowerPoint and the information for this talk. We are now, I can't recall what month we're in of this pandemic, but it certainly feels as though I think it's wearing us all down somewhat. So I think it's important and it's relevant, especially given the important role that libraries have for many of us, and personally for myself and my family. You all have a very important role, so I'm glad to share what information I can and answer any questions that you might have. So pandemics are stressful, and we are certainly living in historic and unprecedented times. There are a great deal of emotions and feelings that can come up during a pandemic that can certainly result in a great deal of stress. So when we think about some of the things that we might feel stressed about and the concerns and the anxieties that we might have, we have fear about risk of illness for ourselves, our family members, our loved ones, our coworkers. We are worried about, the health of loved ones in our family, perhaps people who we know are at risk, our parents, our grandparents. These fears, these anxieties, and this stress can together result in a great deal of, unexpected changes, whether it's in sleeping, in eating, and everyone copes differently or reacts differently. So some people might feel that with the social distancing and the isolation, that it's sleeping a great deal, and others might have problems with sleeping. Similarly for eating, it's this influx of maybe I'm going to eat more than I normally would because I'm limited in terms of my activities. What's particularly important, though, is that during these pandemics, it's not just people who have pre-existing mental health or physical health conditions. Pandemics can also result in the emergence of new symptoms that might surprise us. Loneliness is one that has been particularly focused on throughout this pandemic of COVID, given social distancing and isolation that's necessary to protect some of our most vulnerable loved ones. Pandemics can also result in worsening of mental health conditions for those who have, prior histories. So there are certainly a great deal of things that we need to attend to, and we'll go over some of those. Another thing to mention is that when we do feel stressed, we can sometimes look to, increase or begin, consuming alcohol or perhaps smoking if it's something that we had given up, or perhaps even engaging in risky behaviors such as, substance abuse. Alcohol, tobacco, those are not effective coping ways, and we'll get to that in the next few slides. So inherently, we are all resilient. Bad things happen to us. We know this historically. We have gotten over several historical situations, and the research supports the fact that the majority of adults, the majority of children, were inherently resilient. But there's also a great deal of individual differences in how we respond to situations. And the ability to adapt, the ability to recover from challenging situations depends on a great deal of factors. It can depend on the amount of support you have in your home, the amount of support you have from your coworkers, the stresses that you might be feeling related to your finances. If you have underlying health conditions, these can certainly become factors that might impede your ability to kind of bounce back more quickly compared to others. So some people who are particularly at risk during this pandemic are, of course, older adults, individuals who have pre-existing medical conditions who, as we all know, are at greater risk for the virus. But we also have to pay attention to how this virus is impacting the lives of children, of adolescents, of adults, of all of us. This is really a situation that there is, aside from the increased medical risk associated with COVID to older adults, the psychological toll of the virus is highly significant for all of us. Some other at-risk populations would be essential workers, healthcare providers, first responders, and individuals who overall just have poor coping skills. And we'll talk about what some of those coping skills are, what good ones and what poor ones look like. Next slide, please. So there's one thing to keep in mind. We hear stress and it connotes bad things, but stress is actually a good thing. Stress keeps us productive, it helps us be goal directed, but stress is good when it is short term. Stress, once it is persistent, can have really, really severe effects on our health, both physiologically. There are biological changes to sustained stress reactions, and it then becomes maladaptive. And what I mean by that is what can start off as that good stress of I have to get to work early because I have this important these patrons coming in, or I'm preparing a group meeting and it's going to be great, and you're proactive in that sense because you're working towards this goal. But if it's this constant stress that's now lasting weeks, what ends up happening is that it actually stops your productivity and can result in several physical symptoms as well. So overall, it's, be well aware of your own limitations, but also keep in mind as you work with others and your colleagues, and even now though it's virtual, as we resume some of the in-person activities, is if you feel that you are overwhelmed, certainly do not be afraid to ask for help, but also speak up and offer help if it's something that if you're observing a coworker or patron or somebody that's just behaving somewhat differently and you're thinking that maybe they could benefit from some help, from some checking in, it's always a good thing to do that. Next slide, please. So some common reactions to this virus, and there's several atypical ones, but some common ones, right, are fear of contamination, risk of becoming ill. Several individuals are also experiencing a great deal of worry that their medical services have been interrupted. As many of your patrons might be experiencing, the inability to even get to the libraries, which was, I'm sure, a part of many individuals' day-to-day routine. Those things have been disrupted, and from what I'm hearing, those things are changing greatly with, pickup service, pickup book service, but that's quite different from the experiences that your patrons, are accustomed to, which is being, inside the library and being a part of that community. Some other common reactions are, feeling socially isolated, being alone, and that goes back to this, new psychiatric, concern that we're seeing over loneliness, particularly within older adults, teenagers, and younger children due to social distancing. Some of us might also be experiencing some guilt, guilt over not doing enough, or perceived thoughts of perhaps not doing enough for family members or neighbors or people who we know are in need. Guilt because we're trying to balance too many things as we navigate this virtual world of working from home while also meeting our daily family expectations or other expectations that we might have. So some challenges right now that we're all experiencing is if we think that somebody could benefit for treatment, or if we need treatment, how do we go about setting up those services, and how do we communicate what the right information is to people that we care about and to our patrons. It's important to know that there are a great deal of resources, and those will be shared with you towards the end of this call. There are a great deal of resources for virtual telehealth and other services and brochures and pamphlets that can be disseminated that are culturally and linguistically appropriate. There is also the challenge of stigma that's due to COVID. And I think as we, continue with these reopening phases and the reemergence of this new norm, the stigma piece will be something that we'll have to really be mindful of and sensitive about, especially as we resume in-person gatherings. Next slide, please. So some ways to cope with stress. So we need to keep things in perspective. So it is important to be well informed, but you have to monitor yourself and you know what's too much for you and you know what's enough. And sometimes it is good if you're starting to feel extremely anxious, if you're starting to notice that at the end of the night after you've watched the evening news, you can't quite get to sleep, and you're tossing and turning a lot in bed, and you think that maybe a good thing to do is maybe read the paper in bed. No, stay away from the news and maybe start thinking about different ways that you can change your evening routines. Too much social media, and that's also the same for social media. So going on Instagram, on Twitter, or if you were texting, any of those things, too much information can somewhat result in a sensory overload. And during this time of the pandemic, we are taking in so much information throughout, every day. And there's all of this new information that comes out, it seems, every other hour. And sometimes we need to practice a little self-care if we're starting to notice that we are actually being impacted in a way that's not beneficial to us. So it's important also that if you do, want to stay informed, as we all should, that you are actually getting your information from reliable sources, and some of those sources will be shared with you. And it's important to keep in mind that you really, we don't all have the same tolerance, and we certainly do not all have the same reactions to stress or to, to feeling angry, or to, our emotions and our reactions. There's a great deal of individual differences. So you need to listen to yourself. And by doing, what I mean by that is take care of yourself. So if you're starting to notice that you're feeling tense and your body is feeling tight, maybe stretch a little bit, take deep breaths, going for a glass of wine to help manage some of that stress, that's not a good idea. Instead, perhaps think about ways of maybe getting outside of your home and going for short walks. Try as best as possible to maintain during this pandemic where schedules are all awry, trying to maintain some kind of schedule that mirrors what your life was like before the pandemic, with regular consistency, and taking care of yourself. Next slide, please. So some good ideas for meditation, and there's certainly a lot of resources available online. And these are certainly things that you can refer to patrons, to coworkers. It's stress reduction through meditation. There are several virtual employees who are actually getting together and doing group sessions virtually, and that's yoga as groups, or meditation exercises as groups, and sharing different links, or exercising, in groups. It's also a great way to not only take care of your body and your mental well-being, but it's also a good way to stay connected with your colleagues. Next slide, please. So again, diet is incredibly important, and we need to make sure, especially during these times, that while it's certainly good to indulge, it's good to indulge in moderation. You will feel emotionally better if you are taking care of your body and you're eating well. So according to the American Heart Association, we need to eat a heart-healthy diet. It's important for our blood pressure, for reducing our risk of heart attack, stroke, and other health threats. And even if you are somebody who does not have any of these underlying conditions, if you experience stress and you experience persistent anxiety, these stress and anxiety are associated with increased risk of high blood pressure, of cardiovascular disease. So we want to make sure that we're taking care of ourselves, and that starts with good sleep, good diet, fruits, grains, whole grains, low-fat dairy products, And you can share that information with your patrons, particularly now. Next slide, please. So physical activity, especially during this time, is incredibly, incredibly important. Physical activity, there's, an abundance of research which supports the fact that you feel better, you function better, it helps you sleep. So if you can't sleep at night, perhaps try in the morning when you do wake up, try going for a long walk. One session of moderate to vigorous physical activity can help to reduce anxiety. And oftentimes people will feel afraid or hesitant to exercise because there's this idea that you have to look fit to get fit. And that's not the case at all. It's you start small, go for walks around your block. And what you're going to do is you're going to feel quite accomplished if you do that every day for 4 days, and then the next week it's a few blocks more. So you want to try some moderate to high intensity muscle strengthening at least 2 days a week. There's a great deal of online resources that can help you with this. You don't know how to have to do these things, you can simply learn them. And here we have a link with some classes and workout videos. So again, these are things that can also might seem like something, whether it's for yourself or for patrons, these are things that can really help to also establish some social connections during a time when social distancing is important. Next slide, please. Okay. So we want to make sure, as I said earlier, we all have, there's a great deal of individual differences to how people cope with situations. So it's important that, if you are feeling stressed, that does not mean that everybody else around you is feeling stressed. Similarly, you might be feeling that you're coping incredibly well with things, but it doesn't mean that everybody else is. So it's, be aware of, coworkers, family members, patrons. If you're noticing, significant differences in how individuals who you're familiar with, if you notice changes in behavior. So some very common signs of stress, and I won't read all of this, but I'll read the most common ones. It's just a change in activity levels. So somebody who just seems more fatigued all the time, and that's not their normal. And you know what their normal is, and that just seems really different. It's a very common sign. Changes in mood, so somebody just being incredibly irritable. And again, it's not just a moment of irritability or a day of irritability, because we're volatile, and everybody has the moments, days where we feel good, days where we do not. But if you notice that this is a persistent change, perhaps that's when you want to have a conversation with somebody, or say, are you okay? Do you need to talk? Do you need to chat? Just checking in with someone can really provide an enormous sense of relief for someone if they're feeling stressed and overwhelmed. Next slide, please. Okay, so what is mental health? So mental health refers to our psychological, social, and emotional well-being. As I said, as humans, we are social creatures. We experience a wide range of emotions. With mental health disorders, though, mental health disorders are really characterized by persistent symptoms that get in the way and severely, severely impact our ability to function at work, to have social relationships, and depression and anxiety are, of course, the most common mental health disorders. Next slide, please. So there's a great deal of stigma around mental illness, but I will say that depression is the second most common cause of disability in the United States. Mental health, again, it's not simply the presence or the absence of symptoms, but it's really characterized by several symptoms that together are persistent and greatly interfere with functioning. So the National Institute of Health, which is also a great resource for materials, and the link is provided, I think, towards the end of the slides, is again the most common ones, or the most important ones really are, it's change in moods, change in behavior, complete loss of interest, and engaging in what are more risky behaviors. And for teenagers, that can sometimes be reckless sexual behavior, alcohol abuse, substance abuse, thoughts of suicide, which are prevalent in major depression, and self-harm, which we more often see in teens and adolescents. Next slide, please. So COVID has clearly changed all of our lives, and we need to think about some long-term solutions that can help to mitigate some of that harm and provide much-needed support to teens, to families, to our coworkers, to colleagues, to our neighbors. So it's important to think about how do we deal with some of the stressors during this pandemic and now during this reopening phase that we've all been severely impacted by changes to our daily routine, by loss of important resources and spaces. We need to be aware that these disparities are even wider based on socioeconomic status, and there are several disparities based on race and ethnicity. Challenges are also greater for individuals who have learning impairments and visual impairments. So thinking about the resources that we can put together that will help to address the needs of our most vulnerable populations is incredibly important. Next slide, please. So with depression, depression is, again, it's, I think it's about 7% or actually 19% of adults in the United States at one point in time in their lives will have major depression. It is a very, very common psychiatric disorder. Depression is characterized importantly by depression, irritable mood, and a complete loss of interest. Now, depression and loss of interest frequently, in just common vernacular, people will say, particularly we hear this in teenagers, oh, I'm so depressed. But real depression, what it looks like is, it's a loss of interest in the things that you find most pleasurable. So whether it's spending time with your children, your family, your friends, eating a favorite dish, watching a favorite movie, reading a favorite book, those things are no longer pleasurable to you. You have completely lost interest in everything. Major depressive disorder is not selective. You can feel depressed and have a depressed mood, but that means that you're still able to enjoy some things. With major depression, the important thing is that we can have days where we feel as though everything is just going wrong and there's nothing good, or we're not looking forward to anything. But we typically wake up the next day and things feel better, you feel better. With major depression, that's not the case. With major depression, this depression, this irritable mood, this loss of interest is there for 2 weeks or more. It's persistent. It's also accompanied by 3 or more of the following signs, and that's severe weight loss, change in appetite within the past month. Now, with severe weight loss is indicated by losing more than 5% of your body weight within 30 days. So again, it's not losing a pound or perhaps maybe having a day or two where you're not eating, but in combination with having depressed mood that's persistent for 2 weeks or greater, feeling this loss of interest and this complete apathy, there's a loss of weight, change in your sleeping where you're either sleeping too much or you're not sleeping at all, complete fatigue. So it's waking up and you just, even though you slept 5 hours or 6 hours, you just don't feel rested. Having extreme and excessive feelings of worthlessness and guilt. And we need to be careful because, again, if we think about everything as a context, so teenagers will use a lot of really kind of colorful language of, oh, I'm just the worst, or, I'm such a loser. That's not depression. So you can't look at these symptoms in isolation. They hang together collectively, and the persistence and the duration of time is really the most important. Problems concentrating extend to not being able to decide what you're going to wear in the morning when you wake up. And importantly and critically, it's recurrent thoughts of death and suicide. So screening and treatment are available. Having major depression does not mean that everybody needs medication, but it does mean that you do need some psychiatric attention, and there are a great deal of resources available. Next slide, please. Okay, so I won't say too much here, but depression is different than sadness. Sadness is one of the longer lasting emotions. Emotions are ephemeral, and by that I mean that we feel emotions and we feel them for seconds. Emotion is certainly, sadness is certainly longer lasting. So with sadness, there's a great deal of research that shows we can feel sad for a couple of days. With anger, with happiness, those are more in the moment, responsive, kind of goal-directed emotions. So we feel those, they're short-lived. Depression is different from sadness, though, because with depression, depressed mood occurs, and again, that's for 2 weeks or more. And the symptoms severely, severely interfere with our ability to function. Next slide, please. Okay, so some warning signs that we see in teenagers. It's really about looking at differences from what is the change in this person. So this is not going to apply to all teenagers. Every teenager is individuals, and you have to think about individual differences. So with, some warning signs, is there this withdrawal that's different from this person's norm? Some teenagers have smaller social circles and are very, very content to be at home with their parents or their family and engage infrequently with their friends, but they're quite happy. So if that's the case, a teenager who is exhibiting that behavior is certainly not depressed, independently of any of the other symptoms that I mentioned. But if you notice behavior in a family member or patron that you know is normally very active and social and boisterous, and now there has been a significant change in that, that is something to think about. Some other warning signs might be, wanting more privacy that deviates from that separating, that transitioning period of teenage to adult. But it's this withdrawal. And that also follows with losing interest in favorite activities, which goes back to one of the signs of depression, which is a complete loss of interest in things that were your absolute favorite things. And collectively, when we see those things and they persist, keeping in mind the frequency, intensity, and duration, these symptoms collectively, when they persist for longer than 2 weeks, are concerning. Next slide, please. So depression looks very different in adults, adults of older age, adults at midlife, young adults, children, teens. Younger children it's very rare to see depressive symptoms in younger children. But what we do see is after puberty, teenage girls are twice as likely to develop major depressive disorder compared to teenage boys. We also see this throughout young adulthood. So we do know that that is based to biological changes that happen in women. Men who are experiencing depression, men typically seek treatment less and are less likely to acknowledge symptoms of depression, but they will demonstrate more irritability, angry behaviors, and indulge in reckless behaviors such as drinking excessively and alcohol abuse. In young children, and this is particularly relevant right now during this pandemic, when younger children are really missing that important socialization of being with their friends, younger children might become more clingy. And if you're on a Zoom call or a webinar, and then you have, a young child, it might be that, if you're noticing that for a few weeks now, every time you're engaged in work, there's a lot of clutching onto your legs or clinging or acting out, you need to kind of step back and think about, well, what else are you seeing that might be changing throughout this time? Next slide, please. So how can you help others? How can you help yourself? Be active, go for walks, do what you can. Set up small goals for yourself. It's not going to be successful if you have never run before, but all of a sudden say you're going to wake up every morning and you're going to run 4 miles a day. No, start small. So be active, be engaged, go outside, go for walks. Avoid drinking. Alcohol, will only make you feel worse if you are feeling anxious or depressed. Be supportive. Try, if you can, to set up weekly or bi-weekly calls with your staff, recommend services to your patrons, connect with your family members by setting up bi-weekly calls. During this time, it's really important that everybody have some social connection. So how can you help others? There are going to be several resources for online activities and support groups, that you can recommend. And it's important that you are sure that you are sharing with your patrons and family members and friends information from credible and reliable sources. Next slide, please. Okay, so extremely relevant to right now, it's anxiety disorders. So we can go to the next slide. So anxiety disorders, there are several. It's a cluster of different types of anxiety, and everyone is familiar with post-traumatic stress disorder, generalized anxiety, social anxiety, separation anxiety. So with generalized anxiety disorder, it's typically, it's this fear, this worry about everything. So it's not isolated to one single thing. It is that you are worried about every single thing that is going on in your life. With post-traumatic stress, which is an important one to consider, particularly right now during the era of COVID, as we've all read stories, and perhaps some of us even have some personal anecdotes of people who have lost loved ones to COVID, who have not been able to have spent that time or have mourned that person in the way that we might have normally. So post-traumatic stress, it is a stress-based disorder that can result in several impairments across social and functional and occupational functioning. Anxiety is very common. 19% of adults in the United States suffer from anxiety. 7% of children between the ages of 3 to 17 years of age experience anxiety. Anxiety disorders are commonly, they emerge as this combination of emotional and physical symptoms. Women are more likely to have anxiety relative to men. Next slide, please. So when we think about normal anxiety versus anxiety that is no longer adaptive, excessive anxiety occurs more days than not. Now, this diagnostic cluster is based on a manual that's called the DSM that we use to diagnose psychiatric disorders, but the persistence of symptoms has to occur for 6 months at minimum. Clearly now during the pandemic, one of the things that I discuss with my colleagues is, again, thinking about when anxiety is no longer adaptive and in these shorter kind of time frames. And it really is looking at change in behavior and change in functioning. So a person that has anxiety may feel that it's just incredibly difficult to control their level of worry. There are usually this excessive anxiety and this inability to control worry is preceded by 3 or more additional symptoms that can entail problems falling asleep. So a lot of tossing and turning, waking up and feeling fatigued even though you had your 6 to 8 hours of sleep. Muscle tension, because anxiety is very much a physical response. So feeling just very tense in your own body. Having difficult concentrating, or just feeling as though your mind goes blank, and these things that you do as part of your job, they're even harder to do. So the significant impairment in work, the inability to function with others are all key indicators of an anxiety disorder. Next slide, please. Okay, so I think somebody else is doing these.
Yes, I think Even is gonna go through these really quickly. Just because we're running a little bit slower on time, we're gonna run through the resource slides a little bit quicker. But all of the slide decks and all of the resources that are listed in the PowerPoint will be available for you after the presentation. So this slide is just about recommendations to support emotional well-being in teens. We covered this in the teen mental health, and it's just to provide age-appropriate information. Adults should allow children and teens to ask questions and use websites with COVID-19 information designed for children, and ensure that every conversation is sensitive and responsive so that teenagers feel like they're being heard. Also, try to provide activities to help teens stay connected, and social distancing shouldn't mean social isolation. There are various activities that teens could do while social distancing or while staying at home. Staying connected by writing letters, Zoom chats, FaceTime, watching movies with friends through Netflix party, and more. And then these are just a few tips that Dr. Diminich mentioned earlier, but just to reiterate them: maintaining a daily routine with consistent sleep activity and patterns, staying connected with others and trying to find humor, talking to people you feel comfortable with about your feelings or worries, limiting the amount of time you spend talking about or watching the news or social media, maybe specifically when you wake up in the morning or before you go to bed, and being kind to yourself and each other, and staying connected with people is really important. So these are more additional tips to cope with changes from COVID-19. Encourage people to avoid anxiety associated with the news of COVID-19. Older teens might say that they're okay, even when they're upset, and just making sure that when you interact with any patrons, regardless of age, that you really listen to them and go into it with an open mind, especially if they're talking about mental health or asking for mental health resources. And encourage people to stay in touch with friends and family, and discuss and address stigma, prejudice, or potential injustices if you can, and if that's an opportunity that you have. So some ideas that we found online about how libraries can support mental health were: offer a mental health section in your library dedicated to having autobiographical, fiction, and nonfiction books on mental health and other community resources. This might not be a possibility right now with stay at home and the libraries are closed, but there is curbside pickup, so maybe having a page on your website just dedicated to mental health resources, that might be helpful, or having a section on books about mental health. You could also offer programs on stress relief, like meditation and yoga, if that's a possibility for your library, or going into the healthy eating theme. A lot of people are staying at home, and some libraries across the United States are offering cooking classes with an emphasis on healthy eating that people can watch at home while they're cooking. There's also various resources on cooking classes offered through YouTube and other websites, and just offer a safe place where people can come and ask questions on any topic. So these are some virtual programming ideas from the Colorado Department of Education that we mentioned also in our teen mental health library, and the links for the Google Docs with all the ideas are available on the bottom and will be available to you after the webinar. But some ideas were: Skype a librarian for help with technology, questions about ebooks or library cards, create a study group with high school students to help them find or cite resources, a pandemic book club, live stream your hobbies such as knitting, painting, or embroidery, or doing a craft hour, maybe setting up a current event chat so people can bring current events and discuss them. And so now I'm going to pass it along to Evan, and he's going to talk about some resources on mental health for librarians to share with patrons and their families.
Thank you, Gabby. Hello, everyone. I'm Evan. I'll be talking about different places, different resources, national resources that you guys can recommend to patrons. For the interest of time, I'm going to be running through these a little quickly. But again, just reiterating what Gabriella said, you will have access to all these websites and phone numbers, you know, after the presentation is done. So staying healthy during COVID-19, a lot of it is getting supports, mental health supports, reaching out to other people, other professionals, and also connecting with others, sharing your experience with others. And a lot of these resources will be areas where you'll have somebody to talk to, or you know, be able to get directed to people who will be able to speak with you or your patrons. So the national resources, the first one, the Global Healthy Living Foundation. Obviously, this pandemic is a global pandemic, so there is no shortage right now of a lot of great organizations doing great work, not only on the local level, but also national and global level as well. So this organization provides advocacy, education, research for people living with chronic illnesses, and especially related to the coronavirus pandemic. The Trevor Project provides a plethora of information and resources for LGBTQ plus people related to sexual orientation, gender identity, suicide prevention, and much more. Counselors can be contacted via phone, chat, or text. The National Suicide Prevention Lifeline, that's the phone number. They also have a chat as well. And also they also have a Spanish line as well for those that require Spanish speakers. The Veterans Crisis Line is free, confidential, available every day, 24/7. It serves all veterans, all service members, National Guard and reserves, also their family members and friends. So again, call, chat, text, and also support for deaf and hard of hearing. There are also emotional support helplines. This is from the state of New York. There are limited hours, 8 a.m. to 10 p.m. It is 7 days a week, but also just another resource that you'll be able to speak to somebody, and if you need any further assistance from there, they'll be able to point you in the right direction. For those suffering with mental health as well as substance use disorders, there's a national helpline from the Substance Abuse and Mental Health Services Administration. And the National Runaway Safe Line for people that are thinking about running away, have run away, and are looking for supports, being able to talk to somebody in the event of wanting to return home, or to just tell your story to somebody and speak to somebody that will be able to guide you. The National Domestic Violence Hotline. Unfortunately, because a lot of people are being cooped up in the house together, it just kind of provides more opportunities for abusers to abuse against the people that they hurt. So this is a great place to go to for a phone call. And also the National Sexual Assault Hotline, telephone number, and they also have online chats as well. And that's the anonymous support. And with all this, especially with mental health, it's important to recognize that mental health doesn't only just affect one person. We're all parts of systems. We're all part of a family, a part of a job, a school, a community, state level, national level, global level. So it's important to recognize that when one person is affected by mental health, there are people around them that are also impacted as well. The National Alliance for Mental Health. There's also a link there for resources. And kidshealth.org is another great place to find advice on children's health, behavior and growth. It focuses on education, physical and emotional well-being. And this site also provides helpful information to parents, children, and teens. And I'm going to pass it over back to Gabriella to finish up with the local resources.
So now I'm going to talk about some local resources. I also just wanted to emphasize that the National Alliance for Mental Illness, NAMI, does have a lot of resources on their website, education, helpline resource. It's really diverse. So if you're looking for mental health resources, this is a really good kind of all-around center to find hotlines or just general information, whereas a lot of the other stuff we are giving to you guys is a little bit more specific. So as for local resources, the 2020 Suffolk County Directory of Behavioral Services Guide is really comprehensive and really has pretty much everything mental health and behavioral related in that guide. So it's also available on the Suffolk County website, linked here. There's also the COVID-19 Office of Mental Health, which has a health line. There's the New York State Office of Mental Health for Children and Teens, and there's Office of Addiction Services and Support, and that also has local mental health services listed on it. I also just wanted to show you the 2020 Suffolk County Behavioral Health Guide. This is the first page and kind of breaks it down. It has inpatient programs, emergency phone numbers, outpatient programs, prevention, recovery, and other community-based programs, adult single point of access, community treatment programs, adult respite housing, children's single point of access, and additional services. So this is really a comprehensive guide. I'm going to touch on some of the resources that are in this guide, but I didn't include everything in the guide just because there's so much information within that. So there's Narcotics Anonymous, AA meetings, Al-Anon, that are offered across Suffolk County. Al-Anon is support for friends and families who have loved ones with addictions, and Narcotics Anonymous and AA, Alcohol Anonymous, is for those who have addiction problems. These are the phone numbers and the links if people are looking to attend some of these meetings. There's also DASH, which is the Diagnostic Assessment and Stabilization Hub from the Family Service League. They have a 24-hour, 7 days a week hotline for crisis services, but it's a voluntary program for people who are in a crisis and are feeling overwhelmed due to substance use, mental illness, and other life or stressors. And this is a local program. There's also the Response Crisis Hotline, which is available 24/7. This is also a local hotline for Suffolk County, and it's offered in Spanish. And there's also a crisis text line. If someone's in a crisis situation and you might not be able to call, you could text this phone number and people will be able to help. There's also the substance abuse hotline that is operated by the Long Island Council on Alcoholism and Drug Dependence. It's available 24/7, and it's available at this phone number. And there's also Long Island Against Domestic Violence. So again, with everyone staying at home, there might be an increase in domestic violence, and people can call anytime at this phone number here or visit their website, and it's free, confidential resource for survivors of domestic violence or sexual assault and their loved ones. And there's also this 24/7 hotline for domestic violence, sexual assault, rape, elder abuse, human trafficking, veterans living with PTSD and MST, and it's 24/7, and it's also a local hotline, telephone counseling, information referrals, access to rape crisis counselors and safe centers, and they also have an abundance of information located on their website. And so that concludes the webinar. In summary, we discussed and reviewed what stress is, how COVID-19 might be adding to it, anxiety disorders, mental health during COVID-19, how staying home might affect mental health, the different warning signs, the difference between sadness and depression, common symptoms of major depressive disorders, strategies for supporting mental health, and ideas for additional library programming, and some resources for mental health support. So I'm going to send you this survey linked in the chat box. If you could please complete it. It's the post webinar survey. And again, it's completely anonymous, and it's just to evaluate how effective the survey is. And we're now open to questions. If there's any questions that you guys would like to ask us, please feel free to ask. And if there's anything else that you would like us to do to support you at this time, feel free to contact me at healthy_libraries_program at stonybrookmedicine.edu. If you have any questions for us about health information, if there's any resources that you think your library's patrons would be interested in, if you have any ideas for specific webinars, topics, please feel free to contact me. And once you fill out the post-webinar survey, the only way, since the surveys are completely anonymous, the only way I'm going to know if you completed them is if you contact me to get your certificate of continuing education. So please email me at healthy_libraries_program@stonybrookmedicine.edu to get your certificate of continuing education. And I'm going to send that email in the chat box as well. And yeah, if you have any questions, please feel free to ask them now. And also, if you have any issues accessing the post survey, please let me know. Yes, so if you want this certificate, it's dependent on you completing the pre and the post survey, but since we wanted to keep the surveys completely anonymous, you would have to email me for the certificate. So you can email me at healthylibrariesprogram@stonybrook.edu after you complete the pre and the post, after you complete the post survey now. And then I'll be sending those out to each of you in the next day or two. And I will send you the survey again for those of you who cannot access it. So that's the link to our survey. And I will also put our email in the chat box. If you, whoops, my fault as well. So here's the link to the post survey again. And here's our email.
Hello?
Hi.
Hello?
Yes?
Hi. I'm calling in, so I don't have that chat box, and I have no way of doing the survey.
If you wanted, you could email me, and I could give you my email, and then you could take the post survey.
How do I email? I mean, you flew through your email, so I couldn't even copy it down.
Yeah. So the email is healthy, HEALTH.
I've got that. Healthy, right?
_ libraries
Libraries, okay.
_ program at stonybrookmedicine.edu.
Okay. And then you can send me a survey, or?
Yeah, I can email you the post survey.
Okay.
For you to complete. Let me just.
I also have a question about the DASH. Mental health, the crisis one?
Yes.
Okay, is that just for Long Island, or would that be like anywhere in the United States, or?
I believe DASH is just for Suffolk County.
Just for Suffolk County, okay.
But I can check.
Yeah, Dash is specifically through Family Service League. They have their office in Hopog, and they're pretty well known. They're kind of the only one that are doing what they're doing right now. So even, they get a lot of resources. They get a lot of referrals from Nassau County as well. Hopefully they'll be expanding because the type of work that they do is really, really good. But as of right now, it's just that one hub in Hauppauge right now.
Okay. That's what I needed to know. Okay. Thank you very much.
Welcome.
And what is your name, just so I can email you the survey? Just so
Cecile Prevet.
Okay.
Do you want me to give you my email, or I'll just email you?
Yeah.
Let's turn off the recording, Gabriella.